Welcome to another episode of Not Minding My Own Business. This is Russell Farbiars. I'm joined today by Joshua Brooker from SnapHealth. Josh, welcome to the show.
Thank you, sir. I wish I was as dapper as you today. I am enjoying dress down. Just came back from Father's Day, so
That's nice. I understand you were off in the woods for Father's Day.
I was, yeah. This morning I actually caught a catfish and a few sunnies
Oh, nice.
at the cabin we were at. Yep.
So is fishing a hobby of yours?
No. It was just something enjoyable to do for the weekend. So
Yes. Very nice, very nice. So Josh, can you tell us a little bit about you and about your business?
yeah, so I am very much formally, my background is in finance and engineering, so very analytical, very focused on doing a lot of research to come to a recommendation, in both industries. And my son was born on New Year's Day about 10 years ago at this point, 9.5 years ago, and we got double billed for that. So they said, the hospital basically said technically he was admitted on New Year's Day and his mom was admitted on New Year's Eve, and we had double. Yeah.
That's crazy.
But yeah. And I had 10 months of asking all the questions. So analytical me, I asked, what did labor and delivery look like? What insurance should I have? How do I deal with this and that? And still, had that aha moment after the fact. So since then, we started an actual agency in Lancaster County, but we help clients all around the country. I have clients in 11 states, really navigating not only getting insurance, but also claims and billing support thereafter. So we do quite a bit of work. I do have a cluster up in Leesport and the surrounding areas, ranging from Hamburg all the way, Lehigh Valley all the way to Berks County, trying to figure out the intricacies of the different health systems and how to help our clients. So SnapHealth is really a progression of that agency.
Okay.
In the insurance world, your traditional insurance broker is really excited if they have an ongoing relationship with 1,000 or 2,000 clients in their area. But we didn't start our agency to be a traditional insurance broker. We did it to try and help other people not have the same experience that we did. So starting in about 2018, we started research and development on Snap. So SnapHealth was a way to kind of transcend just a local agency and be able to help more people. My role, I would say over the last couple of years, has been to help our clients and then also to be involved in my trade. So I've been in a number of different trade group committees around policy. And SnapHealth is kind of taking all of those pieces, building a digital platform to help more people around the country. So it'll actually take a lot of the laws that we have been monitoring, a lot of the kind of what I say boots on the ground, right? When we actually deal with clients, what their issues are, and build out systems that would make it to where the next person that has that problem, they don't have to reinvent the wheel because we've already solved the healthcare problem that they're running into.
Right. So a couple of things that I want to talk to you about. So it sounds like your agency sort of does at least two things. One is that you help clients obtain insurance.
Yep.
And do you work with particular providers, or how does that process work?
So we have 50, maybe a little over 50 different insurance carrier contracts. Um, every carrier has to get reapproved each year on the plans they're going to offer. And within those rates that they get approved at the state level is a compensation, a commission amount that is there for the brokers.
Mhm.
Um, so we don't charge anything to help clients, and then we get paid from the commissions. Now, we used to have a model where we did charge a fee to service our clients, um, but those were times when carriers didn't pay to objectively give advice. At this point, most carriers pay about $20 a month per person that we're enrolling in insurance. So two things. One, it's not percentage based. We don't have a conflict of interest to try and recommend a more expensive option. And number two, it's about $20 a month. It's pretty flat across the industry, at least in the Pennsylvania area. Um, so for us, we're able to do our job and not worry so much about one carrier or another. They've flattened a lot of those conflicts. We do have a nonprofit as well,
Okay.
um, that specifically deals in the Medicaid and CHIP markets. So if we have a client that comes forward that they're a startup and they have negative cash, or they're a family that's low income, then we can help them with navigating Medicaid and getting them coverage until they have positive cash flow, or they have a change in financial circumstances.
So Josh, you were telling me that you also work with clients on claims and billing. So how does that process work for you?
Yeah, so generally we're not stepping in when it comes to um, a $20 medical bill or something like that. Generally speaking, we'll have existing clients who will come forward saying, I'm not really sure how this particular medical bill works, where we're walking them through line by line on their bank statements, or walking them through their particular uh, explanation of benefits.
Mhm.
But there are certainly circumstances where we have far reaching arms when it comes to getting large medical bills settled. So I can give you two examples. One was a client of ours who they received a bill for about $150,000.
Oh,
Yeah. So he's a general contractor, very much the type of person that avoids the doctor like the plague if he can help it. Um, and for all intents and purposes, very healthy. And he received a medical bill because he fell off a curve. And, usually hear about that, for older people that they might hurt a joint or something like that, or a hip for falling. But in his case, he found out that he was actually born with one kidney,
oh,
and he was enrolled in a plan that did not cover pre-existing conditions. And that particular plan basically said, yes, you didn't know that you had only one kidney, but it was pre-existing because you were born without a kidney, which gets into the legality of whether or not that's actually applicable, because he answered the questions properly and was insured properly. So we take it in stages. We'll actually advise the client directly to, adding us as the power of attorney. We do go that far. And in his particular case, we actually had to bring in a member of a state legislators office in to deal with the insurance company to get the medical bills covered. So we do hold our clients' hands and deal with it on their behalf. The other one that I'm thinking of was a $750,000 medical bill. Their baby was born in the NICU.
Oh my.
Went to the NICU, and the insurance company stopped their contract with the hospital before the baby was discharged.
Mhm.
So the hospital sent out the medical bills 3 months later, stating, "Oh, we don't actually have a contract with that insurance company." And in that case, we did have power of attorney, and we got everything covered. Um, and the hard part is for a normal individual that is a W-2 employee that doesn't have the means to handle that. They would have discharged that debt, and they would have gone through a whole process with the hospital to get it taken care of. In this particular case, it was a self-employed individual where his business was doing about $3 million a year in revenue. So they could have potentially gone after his business had we not got that claim covered. So generally speaking, we will evaluate how severe the situation is and if we can step in, and then we'll use our resources to help clients navigate the claims process.
That's great that you do that. Now you do this only for your current clients. Is this included as part of what you would do for them, or is there an additional charge when you get involved like that?
There's no additional charge. It's more and it's not just existing clients. We have people that reach out to us, and oftentimes it's me trying to figure out, can I help, and how efficiently can I help, and if I have the capacity, we do it. So it's not something that we charge for. It's not a part of our business model, but it is something that if we know how to do it and get the bill covered, or at least do a clean handoff so that they can get as much help as they can, we will hold their hand to the extent we can.
Okay. Now, you mentioned that you work with Medicaid and CHIP. Do you only work with that for low income families, or do you also work with the elderly population applying for Medicaid?
We do work with the elderly population.
Okay.
We also work as a broker's broker. So we run into a lot of clients where they were referred to us by another broker that helps them on the Medicare side, but needs a hand to hold for the Medicaid side, and we'll step in and help them. Now, Medicaid is broad, right?
Right.
We're not stepping in for long-term care support. We are specifically stepping in for the medical eligibility.
Yeah. I can tell you that because we do the long-term care support, that it gets very complicated in a hurry. So,
Yeah.
And there's a lot there that can be done. But it's great to know that you're there as a resource for people. Now, what's the name of the nonprofit that you run?
It's Helping Health.
That's great. That's great. And so when you work with a client, they don't pay you for the work that's done. It's just your way of giving back.
Yes, there are exceptions, but they really are exceptions to the rule. In general, if I have a client that comes to me who technically qualifies for Medicaid because under 65, there's not an asset component, there's only an income component, and they have $1.5 million in assets, then yes, they make a contribution to the nonprofit. But in a case like that, it is basically funding the other people that need help. So we generally don't charge unless there's a scenario where out of a technicality they qualify. And even in that case, it's $150 donation, which is more than like we probably spend about 10 hours.
Mhm.
So it's time for money. And in that case, it's $15 an hour, which is even
Which is,
undercharging for that cohort.
oh, absolutely, absolutely. Now, you also mentioned that that you have a digital platform, or you're working on a digital platform. Can you talk a little bit about that?
Yeah. So I'll walk you through uh, the hypothetical scenario, and then I'll explain more because I think that gives you
Okay,
some context.
sure.
Imagine imagine you go to a website and you put in my name's Russell, and you don't put in your last name, you don't put in your email, you don't put in your phone number, and you are going there either because you have a lot of medical conditions or because you're one of the 48% of the United States that doesn't get benefits through an employer. And you log in and the system says, do you have insurance? And you say, yes, I have it through UPMC. And I'm just picking them because it's Berks County, and I could go with Geisinger, I could go with anyone, but
Mhm.
whatever. It would reroute you to UPMC's patient portal. You would log in, and it would feed all of your medical claims, all of your diagnosis, all of your clinical data, all of your physician notes into our system. And then immediately at that point, our system would start a live record of you, everything you related to health. So we call it an untethered patient portal because it's not tied to UPMC. It's not tied to um, uh, a hospital system or an employer. You could move to Myrtle Beach and pick it up and take it with you. But it's your health briefcase. And then within that system, we're effectively taking the last 10 years of trial and error that we've done at the ground level and building out ways to help you navigate the healthcare system. To the extent that, yes, you can buy insurance on the platform, and that's really what our first piece is within the system, you'll be able to cover, care, compare, and circle. So cover is obviously, if you're uninsured, that's the first problem we need to fix.
Mhm.
So we're gonna offer an algorithmic recommendation on which plan to pick. If you have insurance and you put that in the system, then we will start giving you all of the notes from all of your doctor's appointments and giving you dynamic recommendations. So yes, you can log into the My Health app from Epic or Cerner or Allscripts, but at best, your hospital has a static website that you can go to log in. It's not giving you insight on how to actually get better at health. So our system will give you things like your doctor prescribed you a medication. If you show up at CVS and try and get a script and they tell you it's $300, it should be a $3 copay, and you may need to request a prior authorization. So that kind of prompting is going to follow you to help you navigate the system. And again, those are from our clients' experiences, where we've had clients that have called and they said, why is this $300? And we say, well, it should be a $3 copay. You probably just need a prior authorization.
So,
Um,
so that's really neat. So it really helps people navigate the maze that is our healthcare system, so that they don't get
yes,
overcharged.
correct. Because oftentimes you'd see that and you'd just pay it. You'd be like,
Right.
oh, okay, my doctor gave me a new medication. I guess this is what it is. You know,
Or- Yeah, you don't know any better because the pharmacist unless you get a good one, because I've had pharmacists who've said to me, no, 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 this isn't right. It should be a $3 copay, but you're just relying on that. So this really gives people all those tools and those resources.
Right. And that goes back to in 2018 when we started down this path of building this system.
Mhm.
I was in meetings with the Department of Health in DC talking about interoperability, price transparency, um, and the No Surprises Act. So I don't know how familiar you guys are with that, with any of those three terms, but interoperability basically stated that everyone now has a digital file. We're not on the paper racks anymore, right? No one's medical record is sitting in their doctor's office
Right.
on the wall. But when we went digital, everyone went with a different proprietary system. So the interoperability laws state that everything has to be the same language. Every hospital, every insurance company has to have a dedicated place that me as a third party can go to, link up, have security protocols in place. And if Russell comes along and wants access, I can go and on behalf of him request that access and pull it into a central system. So,
Mhm.
obviously the other conversation we've been having is when it's you, your wife, two kids, you might have the two kids on chip, you might be on a different plan, and you might have a dermatologist, three primary care physicians, an OBGYN, dermatologists, and one visit to the ER results in four different systems giving you, anesthesiology, radiology, giving you different bills. The idea on our end is everything would be pulled into one system. So you don't
That,
have 13 different portals to log into either just to live. And on top of that, you add your parents if you become their caregiver,
mhm.
and now their portals and their health and their system. So we're really trying to build out uh, a platform not for several different use cases. I have 6 pages of metrics that we're we're kind of tracking as we
Wow.
build out the system.
That's
But
great. So is this live now, or is this something that's coming down the pike?
so, like I said, it started in 2018. The delay is that the last piece of legislation that is legally binding starts July of 2022. So we've been in process building this, um, slow and steady, testing and testing. The platform is set to be live August of this year,
Wonderful.
so mid-August, and we're raising capital at this point. But we've had conversations both with CMS at the federal level, with Penny at the state level, with the Department of Insurance at the state level. So we have a lot of different, Penn State. We had they're helping us with patent work. They're helping us. They have an MBA program that was helping us with marketing as well. So we've had a lot of different, education and government institutions kind of talking through things along the way. But yeah, we've been very handicapped based upon the fact that we're waiting on legislation.
That's often the case, I'm sure, especially in your industry. Uh,
Yes.
Now, is this going to be a service that clients or not yet clients can utilize at no cost, or is there going to be a cost associated with using this app?
So there will never be a fee to consumers to use the platform. Again, the revenue that we would generate would be based upon if people buy insurance on the platform. Our numbers to, I always say you can't drive a car without gas. So
Mhm.
we're not trying to build out a system that we can't keep running. So our numbers that we're running based on assumes only 1 in 10 people have insurance on the platform. And over the long haul, like I said, there are about 70 million people on Medicare. There are currently about 15 million people in the individual market, 80 million people on Medicaid. So if we can help a lot of different people, then we don't have to charge. In addition to that, we have other sources of revenue. The patient portal that you log into on your hospital system, there's a cost for that to the providers. So if we can replace that in the long run, where we are the patient portal, there are other ways that just within existing infrastructure, we can kind of build a platform for the patient first and not have to charge the patient.
Sure, sure. Wow, it seems like you definitely have a lot of very interesting things going on in your business, and it really seems like you are really customer focused. Though, and is this all this all stemmed from your experience when your son was born, or are there other things that have driven you in this direction?
No, I would say that his situation led me down this path. And then over the last couple of years, just what I've seen with all of our other clients, it's either clients don't know how certain pieces of the healthcare system work, or the answers they get from the health system are just flat wrong.
Mhm.
That I kind of feel like it's our duty at this point. I've been in positions where I will tell the client, like, we'll be on a phone call and I'll say, I need to call over to XYZ company or whatnot. Here's what I'm going to say. They're going to tell me that's not possible. I'm going to ask for a supervisor, and the supervisor is going to say, oh, yeah, we can do that. And then that exact situation happens because a lot of your frontline people in the government, in Medicaid, in the insurance companies, they're meant to deal with the day-to-day issues. And oftentimes what I'm trying to fix are the cracks.
Right.
So we've seen so many of these cracks that we're like, oh, I can fix that, but it's going to take me taking step 1 through 5. And we
Mhm.
do get it done, but I get, it worries me a lot when I look at people that have to do it themselves. And
Sure.
the conversations I've had with a lot of the brokers out there that do provide a lot of help, those brokers are in the group market, generally speaking, because they can make a larger impact when it's a 50 to 5,000 employer group. Now, in their case, it's a matter of time, right? If they can help 1,000 people in one fell swoop with an educational workshop on the healthcare system, then they're helping more people. In the same vein, they're getting paid the $20 per month, as I do.
Mhm.
So to them, it's a better use of their time to help the groups. And in my idea, or the way I look at it, is the individuals still need the help. So really, that's what I'm looking to get out of SnapHealth, is we're able to scale helping the individual. Because like I said, most people think, oh, I have it through work. I have my insurance through work. And out of 170 million people that have it through work, there's still 160 million people that don't. So
And, and
that's what we're trying to get to.
you work with clients or customers not just in Pennsylvania but across the country.
Correct. Yeah, we have clients really up and down the seaboard. primarily because we do operate with Medicare, and wherever they retire, we wind up.
Mhm.
But we do have clients in New Mexico. I have a good chunk of clients in Texas, Ohio, Michigan. So there are pockets that we deal with as well. And if it is a state that we don't operate in, much like other professional industries, for us, it's filing in that state and paying a filing fee. And in my case, I will do a lot of due diligence to add a state. So um, when we brought on a dental practice in Tampa, Florida, I went through the process of verifying with the local hospitals, their preferred insurance companies, and then I did a lot of research on the medications to make sure that that group had access to quality coverage and whatever their treatment needs were. So even if it is a state we're not in, we will do the work if a client needs us in one of those states we're not in just yet.
Well, wonderful. Well, Josh, I'd like to just turn for a couple minutes and talk a little bit about you. You do so much, to give back and to help people with healthcare. But what do you do when you aren't working?
Working? No. No, I don't know. This is definitely a job that I enjoy doing. Oftentimes I'm reading policy when I have free time. I am a Bears fan. So I do like football in the fall. Um, I'm a photographer as well. So normally if I'm in a location, like when I'm in DC meeting with the Department of Health, I will make sure that I have a half day or so in the area to walk around and just enjoy the day and take pictures.
Nice.
So I squeeze it in where I can during the summer because it's usually quieter than in the fourth quarter when everyone's looking to get their insurance
Right.
renewals. I will sneak away a few times to go kayaking as well. So just like to be outside and decompress. I'm an
Nice.
introvert, so those are individual exercises. I can play pool. I can, take my camera anywhere and recharge.
Yeah, that makes sense. What's your favorite kayaking spot?
Uh, I, Around here, I've been going to the Susquehanna on the border of Lancaster County and York County. I'll go kayaking and usually for a couple hours. There's Chickees Rock outfitters that will actually take the kayak up the river and I kind of paddle back down. So
Nice. Very nice.
yeah, yeah,
Very nice. Well, Josh, thank you so much for being on Not Minding My Own Business. I really enjoyed having you and learning uh, about how you can help our listeners with all of their healthcare needs. If anyone is looking to get in touch with you, what's the best way to do that?
I would say email or our website. If it is an individual that's looking for insurance, like if they're self-employed and trying to find insurance, they can always start on our website. Generally speaking, I really I delegate my calendar. I don't look at it until the morning of, generally speaking. Erica Hollingsworth on my team is the one that handles it because I don't really know where I'm going from one day to the next, just trying to either hold meetings or fit admin in. So I would say if you start on pahealthaadvocates.com/CAL for calendar, you can always get on my calendar, or if you email me at jbrooker@snaphealth.me, like me, or jbrooker@pahealthaadvocates.com, then I can get back in touch with you.
Well, wonderful. Thanks. Thank you again, Josh, for being on the show.
Sure. Yeah, thanks, Russell. I appreciate you reaching out.